Hello, everybody. My name is Alyssa Trevino, and I am a current BSW student in Human Biology and Social Work Practice class with Professor Francesca Bianco. And for today's assignment, I'll be discussing Mira's case and the different layers of support that influence her recovery. I'll be reviewing her family support system, her social support network, and the community resource that are available to her, and how I would advocate for her well-being as a social worker. Finally, I'll explain how community stakeholders can collaborate to promote human flourishing for clients like Mira. I'll be explaining Mira's family support and how it could help or hinder her recovery. Mira's family background presents significant challenges that directly affect her emotional well-being and her recovery process. She was raised in a low-income household with two parents who were unable to provide consistent emotional stability. Her father struggled with alcoholism and was emotionally abusive when he was sober, while her mother worked multiple jobs to financially support the family, and as a result was often emotionally unavailable. Growing up in the environment exposed Mira to ongoing instability and left her without dependable emotional support from her caregivers. Over time, these experiences contributed to negative core beliefs about herself, such as feeling unworthy, unimportant, or not good enough. Now, this story also shaped Mira's expectations of relationships because her earliest experiences involved chaos, inconsistency, and emotional harm. She now struggles to trust others, including therapists and potential partners, for the future. This makes engagement in treatment more difficult as therapy itself relies heavily on establishing trust and safety rapport. Although Mira's relationship with her siblings is described as strained but present, it still has the potential to serve as a protective factor. The shared history among siblings growing up in the same difficult home can sometimes create opportunities for mutual understanding, empathy, and emotional connection. Now, if these relationships are nurtured appropriately through boundaries, communication skills, and psychoeducation, they could become a meaningful source of support for Mira. However, because the family's emotional environment was unstable for so long, even interactions with her siblings can trigger stress or reinforce old patterns of dysfunction. When family members lack healthy coping skills or have not processed their own trauma, their interactions may unintentionally hinder Mira's recovery by adding pressure, judgment, or emotional tension. Overall, Mira's family system contains both risks and possibilities. Her childhood experiences clearly hindered her emotional development and shaped her current struggles with depression, anxiety, low self-esteem. All at the same time, her sibling relationships, though imperfect, may offer valuable support in her recovery if approached with careful boundaries and professional guidance. Mira's progress will require balancing these realities of strengthening supportive relationships, limiting exposure to harmful patterns, and learning how to build that trust in the therapeutic relationship that offers safety and consistency that she did not have as she was growing up. And next, we will discuss Mira's social support network, including her friends at work, colleagues, and the impact of her social network on her recovery process. Now, Mira's social support system is primarily centered around her work colleagues and small group of close friends. Her friends have encouraged her to return to school and obtain her GED, providing her with motivation and a sense of possibility for her future. According to mayors of 2019, most people spend a significant amount of time in the office, and this often requires frequent interaction and collaboration with coworkers. However, as often happens, relationships have shifted due to changing work schedules and lifestyle demands. Most of Mira's friends now work from home, which has led to fewer social gatherings, a decreased engagement, increasing feelings of isolation. As a result, Mira has experienced heightened anxiety and emerging symptoms of depression. Despite these challenges, Mira benefits from a supportive work environment. As a receptionist at a healthcare clinic, she is surrounded by coworkers who previously formed a positive social group with her on weekends, contributing to her sense of belonging and accomplishments. Her friendships continue to guide her, showing her what she is capable of and reinforcing her goals. However, as her friends transitioned to remote work and social interactions decreased, Mira began to withdraw, often using her GED studies as a reason to decline invitations. Now, this withdrawal has amplified her emotional struggles, including anxiety and depression, which are closely tied to her growing sense of isolation. In the absence of regular social interaction, Mira has come to rely more heavily on social media. This increased screen time exposed her to comparisons, unrealistic expectations, and content that triggers her self-judgment and negative self-talk. While digital communication keeps her loosely connected, it also creates barriers to meaningful social engagement and limits opportunities to build emotional depth in relationships. Now, according to Pietro Monaco and Collins of 2017, social isolation is considered a social threat and is associated with poor sleep quality and an increase in health risk behaviors. Ultimately, for Mira to move forward and towards her recovery, her social support system needs to be strengthened, intentionally rebuilt, and aligned with her mental health goals. Therapeutic intervention can guide her in re-engaging with healthy, supportive relationships and increasing meaningful social interactions. Therapy can also help her establish boundaries around social media use, reducing exposure to harmful comparisons and negative self-talk. Through this process, Mira can build greater confidence in both social and academic settings, supporting her progress towards achieving her GED and improving her overall emotional well-being. Next, I will describe Mira's community support and how Mira's community support can hold a variety of, potential helpful resources. Now, Mira's family, mom, are deeply rooted in the Pentecostal religion. So they do go to church. They do have church members that offer spiritual encouragement, prayer support, and a sense of belonging. Many faith communities also provide meals, transportation, or emotional companionship during difficult times. This type of spiritual and social connection can provide meaning and hope in Mira's recovery journey. The community agencies, including like mental health centers, support groups, nonprofit organizations, and other types of social services, offer structured professional support. These organizations can provide counseling, crisis intervention, case management, financial help, or access to support groups. However, community support can also present challenges if resources are limited. They can even have a long wait list. So if Mira feels stigma when reaching out, it can also be part of the religion, or she can feel that it's shameful for reaching out to attend to any type of mental health. Now, helping her navigate these systems will be important to her long-term success as well. Next, I'll explain how, as Mira's social worker, I would advocate for her well-being and recovery by applying the standards and principles of the NASW Code of Ethics, along with research-based best practices. As Mira's social worker, my primary responsibility is to advocate her well-being, guided by the values and standards of the NASW Code of Ethics. First, I would uphold the principle of dignity and her worth of the person by ensuring that Mira feels heard, validated, respected, and also included in decision-making about her treatment. Second, I would follow the value of service, helping her connect her with the appropriate community agencies, mental health services, or crisis resources that best support her needs. Third, I would practice cultural competence by understanding her family traditions, community values, and cultural beliefs that shape how she views healing and support. Fourth, I would follow the principles of social justice by advocating for Mira's access to equitable resources. This may mean collaborating with community agencies, working on her behalf to reduce barriers like transportation, childcare, or insurance issues, and helping her navigate any systemic obstacles. Finally, I would use research based best practices. This includes trauma-informed care, motivational interviewing, evidence-based mental health interventions, and family system approaches. These methods have been shown to improve recovery outcomes and can help empower Mira to actively engage in her healing process. Now, the National Association of Social Workers of 2021 states that the NASW Code of Ethics defines the values, the principles, and ethical standards that guide professional social work practices. Next, I would like to explain three specific examples of how community stakeholders could collaborate together to help foster and promote human flourishing of clients like Mira. There are several ways a community stakeholder can work together to support clients like Mira and promote overall community well-being. Here are three examples. The Institute of Medicine in 1997 explains that stakeholders include consumer providers, business, government, and other sectors of the community. The Institute of Medicine also explains that as community undertake health improvement efforts, they must remain aware of all social and political environments in which the health system operates at the local, state, and national levels. The ways these environments influence the health system and how the health system in return influences those environments. Now, my three examples of community stakeholder collaboration that will help promote clients like Mira and their human flourishing is adding telehealth therapy sessions. Now, of course, through a partnership between a clinic and a community mental health agency, a therapist could offer on-site counseling 1 or 2 days per week. The clinic could help cover this. Employees would be referred to telehealth services or even have workshops on topics like stress, self-care, self-esteem, trauma recovery could be offered. And why would this matter for Mita? She lives in a rural town where access to therapists is limited. Even Wi-Fi is pretty heard of, but a lot of people can't afford it. And there's a lot of times that they live in rural cities, they're not able to reach out to get Wi-Fi services there. So that can be a barrier. Now, transportation too, at costs are barriers, and she feels the stigma, fearing the stigma from being ashamed from being part of the Pentecostal church, that she's relying on mental health besides prayer, it can cause a stigma. So on-site telehealth sessions will help discreet access. Regular sessions support her depression, anxiety, and trauma-related triggers, and treatment continuity becomes easier to maintain even during busy weeks. Now, this kind of collaboration directly addresses the social determinants of health that impact Mira's recovery, like the cost, the access, the transportation, the stigma, any rural resources that are limited. Social workers use both digital communication and face-to-face interaction to meet the diverse needs of their clients. Now, these blended hybrid models of practice create new pathways of engagement by ethically bridging both worlds. By doing so, social workers can offer meaningful opportunities for clients who live in highly digital environments, as well as those who are socially or technologically disconnected. Now, our argument is simple one. There is an extremely proactive and reliable association between the nature of an individual's social network and their health. And that is emphasized by Cohen, Janik, Diverts, 2009. They also emphasize that this association has implications of both our basic understanding and how social environments shape cognition, behavior, psychology, and for the prevention of disease and the maintenance of good health. Now, why these workplace mental health initiatives promote human flourishing? Now, these strategies help clients like Mira by reducing barriers to mental health, normalizing mental health, offering safe trauma-informed spaces, improving work satisfaction and performance, supporting whole person well-being, mental, social, or emotional, and also reinforcing a sense of belonging and being valued. Most importantly, these collaborations empower Mira to feel seen, supported, capable of counteracting the lifelong messages she internalized from her difficult upbringing. Another one would be the collaboration between healthcare employees, local colleagues, and workforce development programs. And this one is really good here in the Rio Grande Valley. A lot of our employers especially in hospital settings or large companies. They do offer like tuition reimbursement to continue their education. And through this partnership, it allows employees that, it gives them a sense of belonging, a sense of, being able to plan for a future with education. That means more financial stability. So through this partnership, I feel Mira and other employees would benefit. Tuition reimbursement, GED completion, scholarships and certifications, paid study leaves, flexible schedules to accommodate coursework, career counseling, or any grants or sponsorships through state workforce programs to offset any training costs. This collaboration directly addresses the financial and emotional barriers she faces in pursuing her GED and future healthcare career. It also boosts her self-worth, counters feelings of inadequacy, and provides economic stability through upward mobility and healthcare roles. Most importantly, it empowers her with the long-term educational support she'll need, and especially that she never had growing up. How this promotes flourishing, it expands career opportunities and increased financial independence. It validates her potential and strengthens her confidence, improves mental health by reducing stress and building stability. It also provides inclusive, community supported pathways for advancements, and it communicates that Mira is valued, supported, and worth investing in. Now, this type of collaboration aligns with education, employment, and economic empowerment, core components of human flourishing and foundational to trauma-informed and strength-basic work practice. Now, this resource shows that when communities coordinate health promotion and support initiatives, individuals explain better health outcomes, stronger perceived support, and increased engagement in health-seeking behaviors by Specia de Rose, Newty 2024. The next one I would partner with is with local churches, food pantries, and nutritional experts. Local churches, food banks, nutritionists, especially in the hospital, they have a lot of dietitians and nutritionists. They could jointly offer a healthy eating on a budget program that provides meal prep classes. They are going to be culturally appropriate recipes, nutrition guidance using affordable ingredients. This partnership reduces financial strain, increases access to healthy food, and strengthens community connection. Now, the key factor in reducing stress, improving physical and mental health, and promoting flourishing for clients like Mira. Also, another program that's part of a community resource and base program. It comes in alliance too with childcare. And I know it by the YMCA. I know when I lived in a bigger city, I used YMCA for so many reasons, and they have YMCA programs for adults to pick up a gym, to go swimming, and that can also, by using exercise, eating healthy nutrition, that helps a lot of putting the chronic illness induced by stress, and that can create unhealthy balance. Now, in closing, Mira's story reminds us of how deeply a person's well-being is shaped by the intersection of family history, social networks, and community environments. Her childhood adversity, ongoing financial pressures, and social isolation all contribute to the challenges she faces today. Yet her resilience, her desire for growth, and her willingness to seek help offer powerful opportunities for healing. By applying the NASW Code of Ethics, using evidence-based practices, and engaging in community stakeholders, from her workplace to her educational programs to local mental health providers, we can help Mira build the stability, support, and confidence she needs to thrive. Her case emphasizes the importance of collaborative, culturally informed, whole person care. With the right support, Mira is not defined by her past, simply, she is empowered to create a healthier and more fulfilling future. This concludes our assignment in reference to Mira's case and how supporting Mira's recovery through family, social, and community networks. Thank you again. I hope you enjoy.